I thought we had started in. So the first question I would ask, did everybody find Aaron's presentation useful? No. Yes? Were there things you were already doing?
You feel like a genius, you can just find out information just like that, or just one question. So, and you can ask it to play specific movies, or not movies, but music. A person you love to listen to, you can say, play Carole King. She'll run Carole King for 12 hours or forever until you say, shut up. But you always have to say Alexa first, but it's a really great thing because it makes you feel like you have control, which I think is a huge thing with these sorts of problems is you feel like you're losing control of everything in your life. And this is something you can control. Alexa, she's quiet all the time. Yeah. And she does it without anything. So it's kind of a nice thing.
Beware. I'm moving into a new space and I'm looking into some of this stuff, but I don't want too much because I'm afraid it won't work, and then what happens if you're used to it, but nice. And I kept thinking, what do I really want? And I'm excited about this, and I don't think it's that hard with what they've got now. Lights will go on with your voice. And I said, well, I don't want it all confused and you got to go say a certain thing here. I won't remember what to say. But I'm going to have it set up that I walk in the front door and all I can, the house is dark. I'm going to say, I'm home. And it's going to light the far ends of the house, basically. The stuff that I would trip over. And I don't care about the other lights because once I get my bearings, I'm okay. But if you walk in a house, I know I'll start walking like this with my hand in front of me, worrying I'm going to trip on something or there's something on the floor. So it's going to, I have a big space, kind of divided up, not a lot of little rooms, but it will mark the doors where the wall is, and that's all I need. But if the light isn't on, or if there's the light, it's not bright light, you don't know where you are. So I'm concerned about having too many electronics because when they go wrong and he's not around, then I'm lost. But all it has is to keep it simple. And it's just, I'm home. And then I can get to the room to get the light on, but I'm not going to hit the walls or I'm not going to get confused or scared because, I can't tell you how many times I'll walk in and with my hands in front of me, not sure where I am. It's a great idea.
I really like Alexa for the mind games too.
Oh,
I can improve my life.
Trivial Pursuit type.
Well, yeah, and she's got a whole price right.
Price is Right on Alexa?
Price It Right. Yeah, they use the
Amazon. Price It Right, yes.
The Amazon as their store.
But I have a confession about Alexa, and I've never shared this with you, so this is like a true confession. I'm jealous of Alexa because she's really good friends with her now. And she consults her.
Yeah,
she does. She really likes it. But may I mention, have you had Audio Information Network speak? I don't know a lot about it, but it used to be, I live near Boulder, you call a certain number for time and temperature if you didn't have Alexa, okay? And they had a little spiel. Well, now it's run by Volunteers for Audio Information Network. So I'll give you the time and temperature phone number. It's a local call, and listen to their spiel, and they'll talk to you about their program, what they have available for persons who are visually impaired, okay? So the phone number, if you're interested in this, is 303-443-1910. And then they'll give their little spiel for information on Audio Information Network. Go to this website, and then they'll give you the time and temperature. And yeah,
Nice.
and they might want to come speak.
Nice. I will look into that.
I have found on Amazon also there are special box that will tell you what day of the week it is, what time of day it is. It's got contrast colors. It'll even say morning, afternoon. They're about $80, but they seem really great. Mom has her phone and she just asks her phone, what day is it?
Yeah,
Or whatever. So like, I am an Apple person, she's on Android, but whoever her little assistant helps a lot with that too. Because for a lot of people, it's hard to dial a phone number. So you do that when you make a phone call. Just like call. Yeah. Dialing, getting to the screen to even dial it is hard. If anybody else has issues with their, once she gets used to the phone the way that it is and has trained herself, then the stupid thing updates. And so it moves. And so I've spent probably, I don't know, 8 hours messing with it, trying to get it back to normal, but that's a little frustrating.
Yeah.
What is it called? For phone?
Well, the app.
Well, I think any of these smartphones would do that.
Oh, okay.
So
You just said,
it's it would be Siri for Apple.
oh, Siri for Apple.
Siri for Apple, and then it's Google Voice, or what is it? Yeah, it's just voice search on Google on the phone, or they have, I think, different in Google. What is the name? Cortana? Is it Cortana? Cortana.
My husband's not going to get us
I start every morning.
Yeah.
My phone's right by my pillow, and I start every morning with, "Hey Siri," yes, and I say, "What day is it? What day of the week?" And what's the weather going to be? And then I get out of bed. Because I don't remember. Oh, and what time it is? Because I can't see it until I find my glasses. So it tells me what time, reminds me it's Monday or Tuesday, and what time, and gives me the information. Then I'll step out of bed, because I won't remember, and if I step out and don't remember, then I get frustrated.
Yeah.
And this lanyard has been very helpful for her to keep her phone on her too. It's hard to find it sometimes if she had it laying around. So then we kind of invented this little dealio.
Yeah.
So when she's out doing her yard work or whatever, she can easily answer the phone. Because otherwise,
And I got somebody coming to the house.
she gets in trouble. Yeah, 'cause I show up.
It also has a call app.
Yeah.
If she leans over, it sends me a notification.
Yeah.
Is that the information you sent me?
And within 30 seconds,
And I
she's
sent it
calling
to
me and saying,
everybody.
it's not.
And,
She's okay.
my niece, Yeah.
But it's a good app.
Well, hopefully we'll be able to share tips as well as get help from our tech experts when we need to come back for that particular meeting, because it was really successful. I think some people found that they knew a lot that was discussed, so maybe separating people out in a hierarchy of, the basic needs and then sort of higher needs, like we could have somebody there to tell you what to do with an update.
Yeah, that would be awesome, because it just takes a lot of trial and error, like you said, for me to figure out how to get it back to as normal as possible. I don't know if anybody knows, but you can set most of these phones on easy mode too, which makes the text bigger and easier to see. And the apps are bigger too for her. But because I'm an iPhone person, she insists on having Android. And it just takes a long time to figure out.
that's what all the people,
Bless you.
all the people at bowling, that's what they had. And I'm sticking with that. I'm still gonna try it.
We've given up fighting.
She's still a technology.
Yes.
If you're on your own, you don't have a second person with you, I warn you about making it too big, because I Uber, and this is my tech ex. And he had something where you press it a couple of times and it gets large. Well, then I couldn't get out of it. I couldn't get to Uber. I'm stuck there, and somebody gave me a ride home and then when I was home, I calmed down and figured out how, but with the enlarging, if you can figure out how to have it always a little bit bigger, but not have that 3-tap large thing,
Yeah,
because for me, it's,
You can't get back to the
it's
regular
hard.
view.
He could probably, if he had it on his phone, but for me, I just start panicking and it doesn't move when it's in real large. It enlarges the spot, so I warn you all because, then I panic, and then nothing's,
Once you panic,
then
then
it's-
frustrated, and then
it nothing
host
works.
for a little
Yeah, and
while.
had these people not come along, I'd probably still be on that street corner.
Oh.
So, you know, but-
I'm sure he would have found. Let's
Yeah.
say,
But if you got yourself set up with this, then you could just put that in your person that, you know.
Her bracelet
Yeah,
is like a GPS or a shoe it,
yeah.
tag shoe it, and it will tell me, and that's how I know she's not, she's just messing with the bracelet.
Yeah.
Because it'll give
or
me
it's-
her address, and it gives me her longitude and latitude.
Yeah.
It tells me how long it'll take me to find her.
I got all these people.
Yeah, driving the countryside in her own backyard.
I don't know if people know this, but you don't actually need a bracelet. If you have your phone, you can just like press a button that will pin you and send it
Yeah.
to someone. And it will like show your location on a map. And they can even use MapQuest to get directions to like your pin point.
Yeah.
Just to
That
make-
worked for us for a couple of years, but at this point, especially when she panics, like, is this your mom?
Yeah.
Yeah, it's just like your mom was saying, it's a lot of work to get to that point, to drop that pin. So if she's scared and out where she doesn't know where she is, this little guy, she just holds the button, counts to 5, lets it go.
Wow.
It
You've been at,
calls on her speakerphone.
where is
It's a bracelet. It's a B alert. I'll write it down because I have some other stuff.
I have that as well, I sent it out.
Yeah, you guys already.
But I can resend that.
Yeah.
So we've, in the middle of Costco, we've had that, you know, because if I bend over or something, then anything got fallen. And we've been in Costco, you know.
Oh, makes a huge noise, like when the fire alarm's going off in the building. And she'll hold her arm out like I'm supposed to know what to do with it. I'm gonna smother it. It's like, I don't
What
know.
to remember is that Jerry really has tracked over the years all these different devices and even things as simple as, this is a great place to buy shoes that don't have shoelaces. And we have that list on our web pages too.
Okay.
So if you have some of these ideas, definitely let Jerry know. And then if you're wondering about them, definitely go to the web pages. Yep. Okay. We are going to update our web pages, but before we do, I wanted to just pass out the front of our web page.
Oh,
You have even more? Oh, I have. Some people have them. That's excellent. Anybody needs a copy? Oh, yeah. I think it would be cool if we had activities and stuff to go together. Something fun. So, well, and so we can get to know each other. Absolutely. We have, I'm
gonna
sit next to
you.
You know, absolutely. We talked a bit.
Want my friends to, you know, come to my birthday party.
Absolutely. We talked a bit about even something fun like a golfing occasion where.
It'll be funny.
Yeah, maybe not 9 holes, but maybe at a driving range or something like that. So, putt, that may be a better start.
That's all I could do.
That was your fun.
Otherwise, they'll all be lost in the forest.
He was talking about even inviting everybody to like a park for maybe.
Oh,
barbecue
picnic
or
or
anything like
I
that.
think-
Concert. You know, I don't know.
I know.
So we're gonna work with him, and he's going to try to organize things for the group outside of here.
Yeah.
Yeah, working on your.
So,
So I got you in a
nice if we had addresses.
I know.
So
Yeah.
for carpooling opportunities, we can take advantage of that.
No, that's a great idea. People could submit a permission to give addresses for carpooling. It's a great idea. That's a terrific idea.
Yeah, let me ask, if you don't mind, does anyone come from the Lafayette area?
Oh.
Oh,
Really?
Because Maureen lives in
Yeah,
Lafayette.
Lafayette, basic, we're at Anthem, which is basically Lafayette.
Oh, on Highway
You know
7?
where Anthem, 7 and
Yes,
7 and Lowell.
Lowell, 7 and
That's
Lowell.
where Marty
Just
is.
up- just outside Lafayette.
thank you. Yeah, we should talk.
Nice, that's a great idea, carpooling opportunities. And if you, this might be a little bit more difficult, but if you actually sign into our web pages, you can get access to things that others cannot. Meaning, unless you get approved as a member from Jerry, you won't have access to certain information. And so if you approve yourself, or if you get approved to be able to see certain pages, then we can have something that says, I give my permission for you to use my address for a carpool. Okay. There are a lot of great services and apps that you can use for carpooling, but because of, I think, privacy issues, you may want to just stick with our own web pages. Because we have that, you looked at me like, what?
Well, it seems to me that they took that off.
Oh, they did?
Because we were having problems with people emailing through the website. I'll have to check with David.
Okay.
This is back when Zach was with us.
Oh,
And
because
he's now gone, so.
they couldn't email through the site? so
Yeah, there
they
was a
changed it.
problem with the website, and so they, I think they turned that part off, but I'll look into that.
Okay, because it should be like a members only type of section, so that you don't have any information that you don't want shared with anybody outside. And then, of course, if there's any information you don't want shared even with members, you just let us know. So this is on the webpage, is what I'm going to describe, but I just wanted to talk about it briefly because it's going to go away soon. One of the things that I'm going to do is annual updates, and the best time to do some annual updates are shortly after the Alzheimer's Association International Conference. And right after I talk about our updates from 2017 to 2018, I'm going to ask if any of you heard any information that you have questions about, and then I'll give a little brief overview of the Alzheimer's Association International Conference. So more to come on that in a moment. But I wanted to talk about what we did at the University of Colorado in regards to donations that were made, grant funding that was available, and collaboration with anybody doing posterior cortical atrophy research. So over the past year, we've been working with a group at Oregon Health Sciences Center, which we spoke about in the past, but some of you may not be aware, to try to understand how people with posterior cortical atrophy present to the visual side of our healthcare system. We know a lot about how people present to a neurologist or a memory disorders clinic, and we don't know in terms of large pieces of data, we don't know what that looks like when you're presenting to the visual side. And a group of us from here and Oregon Health Sciences sent out a registry, sort of database gathering request from neuro-ophthalmologists belonging to the North American Neuro-Ophthalmology Society. And 38 physicians responded, and we had a total of 46 or 47 patients. None of them came from us, and from me in particular, because I didn't want to have sort of a skewed population, since that's my area of specialty, and so people specifically come to see me for that. We wanted really just, how did they show up in the general clinics without somebody having a specialized area of research and care being under their belt. So we're about to publish that. We're working on that paper right now, but a total of 46 were submitted, and the importance of that is that's a lot. for people who have to spend a lot of time. So the people who responded had to spend an enormous amount of time looking through their patient records and entering data for absolutely no benefit to themselves, just for contributing to our understanding. And so we know that in general, in those types of data collections, we're probably seeing about 20 to 25% of what's really out there. So if you sort of take that number of 46 and consider that you probably have another, 75 to 80 more people that could have been entered in that way just through the group that we sent the information and request to. We're talking about quite a large number of people with this diagnosis that we knew nothing about. So that information is going to come out soon. So that was one of the studies. Another one was just purely questionnaire based to the PCA support group online through Facebook, and just asking questions about when were you diagnosed, how were you diagnosed, what were some of your first symptoms, what do you struggle with, how long have you had it, where do you live, did you have to move out of your house, stop working, all of those things. That one's still in the data analysis stage. It's less likely to come out before the end of the year, but we'll have that as well. And then I did one for caregivers, and it was open to anybody, including that other one on Facebook. It was open to any of the patients that I see, and same with the caregiver one. And all of that data that I just mentioned, all three of those, were presented at the Alzheimer's Association International Conference last year. And as I said, we'll work on getting those things published and available. And they have two important features. One is just putting out awareness of PCA. It's going to help with having other physicians see that information so that they can then say, aha, I think I have a patient with this. Every time I give a talk or write a paper on PCA, without hesitation, I get, or without any type of asking for information, I get feedback from people saying, I think I have a patient with that they didn't recognize until they started hearing more about it. So that's some really good and exciting news about what we were able to do. And we also had, I think as you know, some new collaborations with Jamie Talon. Some of you may have heard of her, but may not have, but she is a science writer, has been working in the neurology industry for many years, a couple of decades. And when she recently did a fellowship at the University of California, San Francisco, and started becoming aware of PCA, she became very interested in helping and supporting the PCA family of patients as well as research. And to do so, she developed an online support group as well as an online lecture series. Jerry will send out announcements about her lecture series and about her online support group. Very easy to access. You go online and you essentially either click to join at the time that it's happening or have a call-in number. Very, very easy. And after not the support group meetings, but after the online lectures, they're downloaded and available for you on YouTube. And you can go through her webpage. And the lectures, go ahead.
Sent one out yesterday, I believe,
Mhm.
to everybody for the 7th.
Yeah, and it
So
was
it's coming up
new,
September 7th. Yep,
Yeah.
it'll be a new one.
it was new that she added that you could go into Zoom and collect it too, right? Is that right?
Yep, you can use,
Yeah, they put all the instructions. in.
Yeah.
all the instructions are on there. And then if you miss a lecture and you want to see it, you go to her web pages and you can click there, it'll bring you to YouTube and you can watch it. Because the lectures have a wide variety, kind of started with some of the basics, like what is PCA? And then I gave one on what is the role of the visual system in PCA? And then it moves on from there. And in fact, the one that you sent out is going to be about CBD and the utility of CBD in medical conditions. So it's related to marijuana, but without the effects of the THC. Yeah, the
Next
high.
meeting
and the-
about-
Yeah,
Our next meeting's about marijuana use.
exactly. So sort of provides a whole other format to get information. And people join from all over the United States. And she's really, really very, very knowledgeable about PCA and what people do. So the last is, and we emphasize this a lot, is our neuropalliative care clinic. A lot of times when people hear the word palliative care, they think end of life care. But palliative care is really just relief of suffering. And because we as physicians are not really able to provide a lot of the services and resources that are needed after this diagnosis, we have our palliative care clinic that can help with that. Whether it be psychological counseling, whether it be spiritual counseling, whether it be resources in the community, whether it be medications that you feel are, interacting with some other medications and you forgot to mention it at a visit, or you just started having it, there'll be physician there, nurses there, chaplains, social workers, all available at one clinic. And many of you have taken advantage of that, but if you ever need to, we have pamphlets before you leave that you can look at. And we really highly encourage you to, even if you feel like, maybe I could use this, maybe not, we will emphasize that you do give this a try, because almost everybody at some point would be able to utilize the services through the neuropalliative care clinic. Because there will come a time where you'll run into a roadblock that we just can't necessarily provide in our clinics. So that's what they're set up for. And next, go ahead. Somebody here? Oh, no, sorry. Next, I just wanted to talk about the gifts and donations that you can give. We know that not everybody can give monetary donations, but your time and effort is extremely welcomed. Coming here not only allows me to kind of see you and see you between appointments, which I think is really important, but also to share things that you've done to improve your life with others. So it is generosity type of act that you're performing just coming here. You may think you're coming here for yourself, but by being here, you really are supporting others. So we want to thank you for that, as well as donations that you can make after death. And we've had 2 donations that have been made with brain autopsies after death, people who have PCA, and they donate their brain for research. And we have a brain bank to be able to store brain tissue and work with researchers throughout the country who are interested in studying PCA. And because that is a very difficult topic to discuss, and there's a lot of cultural and spiritual and religious reasons why you may not be interested in it, I did want to bring it up well before any time period where it can be stressful to think about. And so we have a handout that is about donations of that matter and of that kind. And I just wanted to pass that out for people to think about. We're going to be hopefully building up that brain bank, we call it, so that we can offer the types of tissue to researchers all over that are just currently not available. When I looked through, so there are brain banks throughout the country, and one of the pushes by researchers is to try to have brain banks that are managed in one location. And one of the reasons for this is because anybody anywhere can then go onto the internet and say, okay, I'm interested in this disease. Where can I get tissue of this disease to make it much easier, instead of emailing a colleague and say, do you know anybody who has this tissue that's available, brain tissue? And so this has been a big drive and push for research in that manner.
I signed up for that, but I don't understand. I died on the bus today. How does that message get to them that my body needs to?
That's
How
what
does that work?
That's what that handout is about, because we need, no, don't worry about that, because we want to plan ahead of time. And it can be as simple, literally as simple as expressing to me that you want to, and letting loved ones know that you want to. Because once you pass away, there are actions that are taken where you're going to be asked, your loved ones are going to be asked, did she have any wishes about burials? Did she have any wishes about donating organs or donating brain tissue? Those types of things are asked. And so it can be as simple as just
Who are they asked
expressing.
from?
So next of kin,
Okay, but who's gonna ask them?
if you're in
The
the hospital.
hospital.
The hospital?
Well,
Hospital?
if you died
What
on
if
a
you're not a-
bus,
yeah.
okay, so if you died on a bus, basically what will happen is your body is taken to the
Morgue.
county, the morgue, and they have processes and protocols in place where they say, we have to notify her next of kin. And in that process is when all those things are asked. Or the next of kin says, this request was made by my sister that my body is donated to the American Heart Association or the Colorado PCA Brain Bank, or whatever it is that
That
you're
could happen
interested
like a
in.
day after.
Absolutely.
Okay.
But should we truly think this through before anything happens?
Exactly.
Because
But now
when
do
they asked me for donations on my brother the night he passed away. And we did what we thought was the best thing we could do, that he would have thought as an honor. But that conversation did not happen without him before he passed.
That's exactly why I was bringing it up, because it can be,
It's
for
a tough
so
time
many
for people
reasons,
to figure
it's,
that one.
yes, it can be chaotic, it can be very emotional, and you can have different beliefs than your family members, and knowing that they're honoring your beliefs are going to be very important to them.
It was very, he had never said anything, but, and part of it as well is, like for the eyes, there's a window of opportunity for them.
Right.
They can't wait 5 days for us to have the photos of them.
Yeah,
They need to
living
know.
tissue,
Yes.
living tissue has to be very, very, that's why, states have driver's license that
I
have,
was going to say, what if you
because
signed up
living
for that?
tissue, it has to be very, very quick.
What if you already had signed up for that? Then how do they share it then? Do they
Yes,
share-
so anytime somebody dies, whether it's in the hospital, at home, on a bus, there is a protocol that's immediately put into place for those things.
Okay, now if I signed up for the state, which I did a long time ago, then I signed up for you too. Is that that's
No,
doable?
that is doable. What we, can you just see if that's from the hospital or not? 201? No. So,
I'm just
No.
curious how that works.
so the number one priority is the living donation, right? So the number one priority is, and should always be, is living donations of your eyes, your heart, your kidneys, whatever it is that you're interested in giving. Because those have to take place, obviously, very, very quickly. And they will take place if you have that information registered. Once they identify who you are, there is a database that comes with when you sign up, when you put it in your driver's license, that automatically kind of happens, and you don't have to, your next of kin usually doesn't have to worry about that. So that's usually the priority. After that, there's no nationwide database that identifies you as wanting to donate your brain to a brain bank anywhere in the country or even here. That's where the next of kin comes in that has to say. So what you're mentioning is, what usually happens is hospital teams will approach family members and say, your loved one had a healthy heart, would you be interested in donating? That kind of thing.
Thank you.
Okay.
So I have a couple of questions. First of all, if I were to donate, you know, my body. Well, I know. But I also, what I wanted to have happen, one of my friends, her daughter was killed, and those folks decided that they were going to take little samples of those. She had, sorry, Cindy had her body cremated, yeah. And then they would go to, you know, they went to Hawaii, they you know, so I want to do that, but is that gonna impair this process?
No, those are great questions. So those are all the things that, by thinking about this early, you can ask those questions, and we have some telephone numbers on there where to just call up and ask. But generally speaking, even with brain donation, you can have open casket for funerals, and it should not affect cremation or other burial. And of course, depending on what somebody is donating, will determine what kinds of arrangements you can or cannot have, right? So even in cases where you're donating your body for medical study, at medical students studying anatomy, for instance, they will prepare things so that you can have an open casket funeral and then the body is donated. So there's so many ways and methods to go about this that if you have concerns, you can call in advance and say, this is one of my concerns. That cremation is no problem after brain donation, and either is open casket.
Great. One of the things that I don't know if you guys are aware of that you can donate that's really needed is skin.
What?
Skin for burn victims.
There's so many ways.
There's so much that can come this that will help the next person's life be better.
Especially your brain.
Yeah, and when you think about it, there's nothing more precious than doing that. On the other hand, we know that there's many spiritual and religious reasons why people wouldn't give, and that's fine too. It's something that everybody should sort of talk about with their families. So, that up.
So should that be on like an advance?
Part of your living will should be.
And again, even a simple discussion with family can really save family members when they get approached by hospital for living tissue donation. Really ease that burden. Really anything that you want your family to know or that they could be asked after you pass away. I've been having these discussions with my husband for years because, you know, it takes the burden off of them. And why I say for years is because sometimes you change your thoughts over time. And because it really, having taken care of hospitalized patients for many, many years, you can see families struggle after somebody passes away. Would they have wanted this? What did they want? And then somebody will fly in who hasn't seen the person in a long time and doesn't think that that's what the person would want. And so, getting your wants and needs out there is just really, really important to family members afterwards.
being a pragmatist, we pay for our funerals, our cremation, our vaults, everything, we're done. So should this information be given to the mortuary?
Absolutely.
Okay, then that just takes it from everybody.
Exactly. That just takes it away from everybody.
I'm gonna suggest to you that you come up with a little card that I can carry in my billfold for anybody who wanted to make a donation. That way, if I happen to die on the bus with my billfold, they would be able to know that a donation is in. Because they handle things differently.
Yes, definitely. They handle things differently. And so one reason why we have to act fast, but again, the
Not too
simplest,
fast.
not too, the simplest is just telling people. That's just the first start. And then we can do all these other things to make it easier on your family, the mortuary, and everybody else. And well, with that, I want to tell you that Mr. Tiffany, which some of you may have not known, because he lives quite a distance away and hadn't come to the PCA in a while, did pass away last week. He was a gentleman with posterior cortical atrophy, and he expressed many times his need to make a brain donation. So he did. He made a brain donation, and I think it made it a lot easier for his brother and his friend who cared for him. And because of some of the chaos that can always ensue, we thought we would bring this up today so that we can think about it early.
Isn't there some sort of a story or something that you're supposed to do with 5 wishes?
Yeah.
7 wishes?
Oh, yeah.
Something. How many wishes?
Talk about that one. Oh, the 5 wishes.
5 wishes?
I think it's called 5
I
wishes.
think it is too.
Yeah.
And where can you get those?
Is that
Because that would.
Dr. Vaughn, Dr. Vaughn from the neurology resource and palliative care clinic came here and spoke. Did she include that in her slide set? Oh, look.
The welcome symbol in there.
Okay, we'll keep that listed in. For these questions, so that we don't forget and don't just throw them on the webpage, maybe we could bring a handout for all the questions that were asked. So far we have the wishes.
With the doubling of donations. Now, if it's on your license, it would go one place, right?
Right, exactly.
And plus you would go another place. So how big one?
Right, we can bring next time maybe the wishes. We can just bring a signature page that says I'm interested and I want to hear more, or I definitely want to. We can bring that to the next support group meeting. We can bring our list of devices that we have heard about and helpful hints. And not necessarily just devices, but like I said, even shoes that are easy to put on have been something that people have brought to our attention. We'll bring that list. And then next, I just want to update people on the Alzheimer's Association International Conference that takes place every year. And it always happens in July. And it oftentimes is overseas because it is an international conference. And this year, however, it was in Chicago. And did anybody hear news feeds that came out? So usually in the summer, you'll get a big boost of publicity about Alzheimer's, and it's because of the Alzheimer's International Conference.
Something about a new drug.
So you heard about a new drug? Did anybody hear about
I
anything
heard it
else that they want me to expand on?
Dr. Al.
No, this was just a blurb on the international conference that said somebody, or the FDA.
Something about a new drug, right?
Right,
Okay,
yeah.
so the big splash that happened was when they looked at one of the infusion type of drugs that binds to proteins in the brain that cause Alzheimer's. They found that people with very mild disease, not people that are already have significant dementia, people with mild disease did better than people who have mild disease and didn't get the drug, essentially. And everybody was very excited about it, but then there was a lot of controversy about how they analyzed the data. So what they did is they removed some people in the treatment population who had a gene that makes them at risk for Alzheimer's disease, and did so because they felt that those patients were at very high risk for moving on to develop more disease faster. But they didn't remove that group from the group that didn't get treatment. So I think it's pretty clear, just saying that makes you realize why people are now skeptical of that. So it definitely showed a difference in the group that do not have genetic disease compared to a group that were not treated, but some of them have genetic risk. So.
You're speaking of the drug like Aricept?
No,
Or
this
it's
is a drug that you get infused that's in the research stage, it's not approved, that binds to proteins in the brain that cause Alzheimer's disease. And the idea is you bind to that protein and clear it out of your system.
What is it? What's the infused process?
The blood.
Infused through the blood. Yep.
More than once, right?
Yes. Okay. That's would be the idea. So,
And for our situation,
so what you, if, let's say that despite this controversy, this drug became approved, you would have to have proven amyloid in the brain. So for treatment, you have to be able to show that you have amyloid in the brain. There's only two ways to do that. That's using your spinal fluid to do measures, and which is lumbar punctures. Yes, yes. And another method, which is not yet approved for use in everyday clinical care, which is imaging of the brain with a PET scan that is called an amyloid PET that binds to the amyloid and shows you on the imaging that you have amyloid or you don't. Insurance does not pay, and we don't do spinal fluid analysis for amyloid as part of a routine clinical evaluation for Alzheimer's disease. And we also don't do PET amyloid imaging as part of a routine evaluation. But Medicare right now is looking at data to see whether or not PET amyloid imaging is helpful in caring for people once you know the diagnosis. That was called the IDEAS study, and some PCA patients did participate in the IDEAS study. Because the IDEAS study had a very limited inclusion criteria, which means you have to meet these certain standards to be a participant. Many of you were not even aware of that amyloid imaging study. But rest assured, because you've given me all of your permission, that when something comes up, like a research study, we go through the list of people who have PCA and see who's eligible. So if you were not contacted, you were not eligible. Without a doubt, every single person who has seen me, we go through every single chart to see who is eligible.
So your request for lumbar punctures does not include the amyloid study.
Correct.
What happens to the fluid? Is it out of, does it go old? Or does it?
Yeah, so the hospital after a month disposes of the fluid. They keep it for a month just in case. Let's say you want to order something and the order electronically doesn't go through because you failed to sign it or you deleted it or something. They store it for a month so that if you forgot to order a study or if something forgot to be run or human mistake, they have it available, but after a month they get rid of it.
So we have to go through that process.
Exactly. So there is what's called a bio-AD, which means biological markers or biomarkers for Alzheimer's disease, bio-AD study. And our principal investigator for that name's Dr. Breon Betcher. Some of you maybe already know Dr. Betcher. She's a neuropsychologist, a research neuropsychologist who works with me. She's now going through very carefully all of our patients who have PCA to see if they're eligible for that study. That is not a treatment study. That is a study where you take spinal fluid, you take blood, and you just store it. And you do an annual MRI scan and an annual neuropsychological testing. And they store all of that data. It gets stored so that any researcher who is interested can then use that data to do research.
This has been ongoing for a while.
This has been ongoing
It's not
for
a
quite a
new-
while, no. But it was not opened to PCA until earlier this year. It was select few PCA, but now she would like to open it up to not just a very narrow definition of PCA, but to anybody with PCA. She's going through their charts for eligibility. And it's the same, you will get a call if you appear to be eligible. Okay, now, moving on to another topic that I think many of you haven't heard about is that at the annual conference, there are professional interest groups that meet, and each of these professional interest groups have a specific area of interest. And one is PCA. And I've talked about that before. We have people from all over the country and all over the world who have this particular interest. And our next year's goal is to put out, just so you know, is to put out a paper that talks about which direction PCA research should go in and what types of tests and measures should be used when you're doing both a diagnosis in the clinics and potentially what is needed for treatment studies. So I'll just give you an example. When we do Alzheimer's treatment studies, we give a drug, see how people respond. At the crux of those studies are memory tests, right? So you give a person a memory test, and then you give them the drug, and then you give them the memory test again, and you keep following them. With PCA, as many of you know, memory can be very mildly impaired, not at all impaired, or be very stable at whatever level for quite a while. So we can't just give memory tests to people with PCA. When you don't have good tests to give that have been studied in research over time. So our goal with this upcoming year is to put out what we call a position paper on where's the next step in PCA research. What do experts think may be the best instruments to use to diagnose it in the clinic, and what is the future of those instruments in use in research? So that's number one, and I think that's very, very exciting because with each one of these papers and projects, so many more people become aware of PCA. The second one is a registry. Just like the bio-AD registry, we would do one for PCA, the bio-PCA registry. Obviously, there would be overlap. So if you're already in the bio-AD registry, all that is shared. It's part of the same, that would be the goal. We don't know yet. And this was proposed by yours truly to this group of international researchers. And the reason that we're not going to do that first is manyfold. Number one, the effort is tremendous. And there's a couple of other things going on that are taking people away from being able to put in that effort because it's going to require a very large grant to organize. However, what we want to do here is a mock-up, so to speak, of a large national and international registry. So it would just be called the Colorado PCA or Bio PCA study, or the Colorado PCA registry, which would be fluid samples for anybody who wants to donate their spinal fluid. It would be blood samples, neuropsychological testing, and we would just start with anything that's already been done in your regular care, right? So obviously it can't be done if you had a spinal tap a year ago, or obviously you can't donate your spinal fluid if you never had a spinal tap, because it's not always necessary. So if we just start with whatever things that you've already had done, or if you're giving blood to have your anemia checked or your cholesterol checked, that's a sample can be used at the same time. It's going to be something like that. So look for more information about that. And then lastly, just to finish up in the very last minute, this is a lot of information for everybody to take in. So this is the last point, is the big theme of the Alzheimer's Association International Conference was about healthy lifestyles and the 3 things that you can do to slow disease down that's related to PCA as well as to the overall Alzheimer's disease. And that's social engagement, so staying very socially active with friends, family members, anybody who might share your same interests, even going to the library when they're giving talks on a subject where you're sitting and just sitting down and talking to the person next to you. And then intellectual engagement. Going to a talk at the library would get 2 of those things: intellectual engagement as well as social engagement. And that's where you hear about crossword puzzles, but it can be as simple as, watching a movie with somebody or listening to a movie with somebody and talking about what it meant to you and what you learned from it, even if it's not a movie of a documentary about something. So it can be really, really, really basic. It's just keeping those neurons firing. And then a healthy lifestyle, diet and exercise-wise. Every single one of those things have been shown to slow disease, to help prevent disease, and to for people to live a healthier life physically as well, of course. And that was one of the main themes of the Alzheimer's Association Conference. So a lot of data was presented supporting that.
Do they recommend having a puppy?
And having a puppy, that
too.
there were actually a couple of posters about animals and social emotional support that were positive. So you're not too far off there. The data wasn't large, but huge.
It gives you something to do and take care of and feel important, which is very important.
Support too.
Don't think I haven't forgotten that you didn't pick that up some time ago. You didn't want to touch it, but now we know.
So what she's referring to.
Yes, you knew. I said, I think I need a dog.
There's a split household opinion over there, and I was asked to break the tie.
She refused.
She refused to break the tie.
Get her a
Let's have that.
Yes, a small puppy. Small dog, not a big dog.
I know. We currently have a split household too.
Oh, really?
Yes, and I will confess I'm on the puppy side. But I feel for the other side too, so I don't.
I feel for it too, but,
But not that much.
not that much.
I will tell you, if any of you live in your house alone, it's wonderful to have dogs, My girl dogs have real big, barks and stuff and everything, and they just love me no matter what. Yes, they do.
She gets a dog, she will be living in her house.
Now you see why.
You think he would change his mind because I've taken to going, good boy.
Well, I think Marie had a nice resolution. She does sits periodically. So she has the best of both.
Yeah,
I
that's
don't
true.
have the expense.
And you don't have to have a
I
puppy,
get some money for it.
with the puppy, you start at ground zero, which includes peeing, chewing doors, shoes, everything.
I know.
But you can adopt an adult dog. There's
Yes, and I
two or
said that,
three.
the adult dog would be
Let's
fine.
move on.
Every dog.
How many people are interested in somebody coming to talk about service dogs?
If they're on my
Yeah.
side.
I mean, our very own members who could weigh in.
My dog Zizi came from a high hill, place and, shelter and, I was having problems because I was, falling down and all that stuff. And so from that point till now, if I am taking a bath, she's right there. Head right there. And she's a big dog, so if I did need somebody to fall on, she's right there. Dog, same thing is if I'm out in the yard, she's tracking me because she's making sure that her mommy's okay.
More than I can say about my dog.
I've never had a husband that acted that way.
Let's put that on for service animals.
Yeah.
That would be great. There's so much to learn about who, what, where, how, and we can learn from people who already have them.
And it also makes you get up and do stuff. I have to feed the dog. I have to feed the cat. I have to feed, I have to go looking for the cat when he decides he wants to go out and I didn't want him to. But it's like, these are the things that drive my life,
Just so you know, she also has to do poop duty.
That's okay.
Yeah, that's what you don't talk about. Once a day, at least.
But she does it. Anybody that has a dog, a suggestion on size? Smaller?
I would
big
say
dog,
medium.
Medium size.
Her perspective is different.
It's a size, you have to think about what you want because I have big dogs. I like them because as I said, I live alone, and the dogs are big, and, but, if, the other thing is Maisie will get up on the counter because she's afraid of what is it, the little squirrel, no, it's not the squirrels, it's the little bunnies, yeah, the bunnies. The bunnies. Maisie will get up on the counter. She's scared. She thinks that she has to take care of me because
There's bunnies in the house.
I have two littles and a big. Personally.
I just visualize small dogs as
Smaller,
possibly
medium.
being a tripping hazard. Well, whereas
Big
a
ones
big dog will
But
teach
they
you
learn
to
really
lead.
quick.
I was gonna
You
say.
fall on them one time, get out, and they go, oh, that wasn't fun. So they figure it out pretty quick. Both my little dogs will walk backwards hopping because I'm going to feed them. But they also don't give me this much space because if I go down, it's gonna hurt somebody, you more than me.
And
But I also have one big dog.
I was gonna say, I can speak on people getting tripped up in leashes, and it's not
Yeah.
just, PCA, it's anybody that has low vision, it can be a problem. That's why the service dog or a well-trained dog is really important if you're at the point where that's an issue. And we have a dog right here, you may not have noticed.
Yes.
Yeah,
No,
yeah.
you're right here.
Really good dog.
Yeah, see how good and.
Yeah.
Well, and you need to Yeah,
what
yeah,
are your
yeah.
arrangements? What are your
You need
thoughts?
to train them. I trained my own. I found it, she had been a pet before, I had some other things wrong with me before I realized that I needed a dog. And I didn't want to get a dog. I wanted her because we had bonded. So I found a place where I could train my own dog. And I put in 1,500 hours of work. And basically what you teach the dog, you teach the dog how to learn. And she is so intuitive, and she changes what she does according to what my needs are. But I can, if I think of something else I want her to start doing, she'll start doing it.
Yeah.
But the big thing is the public access. And will be tested every year for public access. And that's the big thing. And so the dog has to be able, and that's what you spend most of the time doing. Is they teach you how to teach the dog. And then also she can go, I mean, she has some back problems, so that's why she gets up and shakes all the time. But other than that, I can take her into public. She goes under the table when I go to eat. She
Jump on people.
She doesn't jump on people. Because she had been a pet first, I let her, when I'm very friendly with somebody,
You allow it.
I allow her to do that. So she's not as strict as some of the others, because I had her for 3 years before that. So, I'm in the Uber car. I let her go, say hello to the Uber driver, but then she's right next to me. She doesn't move. I have with me a cleanup kit. And every place I go, I have a cleanup kit. You learn how to be in public with the dog. How to protect the dog, how to protect the people around. She shouldn't be bothering anyone. And it's a process. It takes a long time.
One of the things to take into consideration is if there is a possibility that at some point in your future, you might need to move to a different home, like a community facility kind of thing. A small dog is often allowed, a large dog is not.
But they look for the personality and, their ability to learn. And it's a process. I don't even realize it all the time. Erin will point it out to me. I started to get anxious and she's by my side. And I don't know what happens at night, but I wake up in the morning and she'll be on my back. And I'm in the deepest sleep because somehow she's figured out how to do it.
She's taking care of
She
you.
takes care of me. When you talked about the shower and things like that, and she'll pick things up for me. I'm teaching her now. I leave things, and so the new thing I want to do. She doesn't bark, so I have to catch her a few times. She barks. And so if I leave something, bark. And we've been talking about things that we want her to do, and the next big one is to teach her to push a button if something happens to me. And that was the one that stuck. I kept asking, how do you teach them to do something if you're not there to say push a button? And I guess they learn to break a command. And so they go over, and if I fall or something, right now, if my phone rings and it's over there, she'll go bring the phone to me. And I can tell her, go get the phone, and she'll bring it to me. So that I know that she's not good enough now to, when I lose it, but it's when go get the phone or when it rings, she'll find it out. Yeah, offline, but she kind of watches where it goes.
Can you tell me the name of the company or where you went to that?
It was Domino Service Dogs. But it's very, very small. It's a non-profit. Pardon?
How long did it take?
2 years.
It's really good to have dogs that know English, really.
But it was a lot of work, and I had a hard time getting the commands. The timing has to be right. It was hard for me.
Yeah.
She's a smart dog, and she learned in spite of me. That was always the joke. But she figured it out in spite of my inability to train very well. But there's a certain mentality, I guess. I just got lucky. I had the dog first, and they would comment that she was exceptional and use her a lot for, examples of learning something. But it's a big process. It's not just getting a dog. And if you travel, I mean, she knows to, if I travel on an airplane, her command's invisible, and she just goes under the seat, and I don't see her the rest of the flight unless there's turbulence. And it's a lot of work, but I think you really think it's important. And he points out a lot that she does that I don't even realize she does.
The only thing that should be pointed out though is that if you go the route of like having a dog and train on them to be a service dog, they're only a service dog when they want to be a service dog. They decide like some nights like she's awesome, other nights we'll be at a restaurant, she'll be like running out trying to swipe thing off of like people on the floors.
No, she doesn't.
She missed it.
All right, some things. We're working on you here. And you're not paying attention. That's a long time ago. She doesn't. There you go.
I had heard of, but, like here's something they said recently. They said when you go out to eat, she goes under the table. And they said we should check under the table because a lot of elderly people, or I guess people like us, we're taking our medication and we'll drop it. Or there's some food underneath there that isn't good for her. So you're supposed to check under the table.
Yeah.
Well, I've got rods on my back and I don't see well. And so this is like really stressing me out. I mean, I'd have to probably get on my knees. So whoever I'm going to dinner with, I ask them to check under the table.
Yeah, that's a good idea.
But it's somebody else to take care of, and that's a good thing or a bad thing. But I'm not sure I'd be doing this stuff without.
Oh, yeah, I mean, that little dog, she's big, but now, I want to go to the Yucatan. And I'm going to go, but I've got to get people in to take care of my dogs. Because, I love them to death.
Very good for you.
They really are.
I have two kitties, and I just have to say something good about my
Yes.
kitties. They're wonderful. They might not get you the phone, but they're really lovely. They cover the TLC part.